Fistula surgeries or fistulas in general, they are a very unique condition that happens, and usually it has a lot of social, economical encounter that these ladies usually go through. Usually it affects ladies who are young, very young, most probably teenagers who are trying to give birth, but because of lack of proper maternal services, they end up laboring for long until they end up injuring the bladder and they end up having fistulas.
Nilikuwa mjamzito na nikajifungua kwa njia ya kawaida, but ikaonekana kwamba mtoto alikuwa mkubwa sana kwa kilo 5. So ikabidi karibu upande wangu wa uzazi. So hiyo upande sana nilikuwa tunapitisha choo bila kutarajia. Sasa ikanibidi mume wangu akaniacha kwa sababu aliona sifai tena. Mimi si mtu wa maana kwake tena. Sababu ikifika wakati wa ngono inakuwa ni vigumu. So hiyo kujifungua katika hiyo hali mpaka leo ni miaka 12 nimeishi katika hiyo hali bila msaada yoyote. Yes, tangu daktari hapa Lodwa. So wakati siku moja nikaja nikamdisclose hii shida yangu. Wakati aliponiambia akasema kuna kampuni inaitwa Amref inasaidia watu. Hebu nitaweza kutafuta jinsi ya kupata wao tusemezana, alafu pia nitapata ripoti kutoka kwake. Nikafurahia sana vile nilivyo, nikaona at least maono yangu ya kuwa tena mke mara ya pili upya ila at least inaanza kuonekana kwa umbali. Mwanzo na sasa nimefikia kwa sababu hata naweza nikakaa na wewe saa hizi. Lakini bure wakati ungevumilia kukaa na mimi. Kitu cha kwanza hiyo funeje ilikuwa inatoka. Unaona? Sasa saa hizi mimi naona nimerudi mwanamke mara ya pili tena fresh kama vile labda nilipozaliwa na wazazi wangu. Kwa sababu hiyo operation imenisaidia. Saa hizi hata naweza nika hold choo. Lakini wakati usingesikia hata kwamba inapita. Niko sawa kabisa, hata niko msafi. Lakini wakati ile ilikuwa ninashinda nikioga kila saa, lakini hata kuoga ilikuwa inisaidia na lolote kwa sababu tu baada ya muda tena hiyo kinyesi inafanya nini? Inapita. Matarajio yangu sasa ninajua kwamba mimi napenda biashara. Lakini kwa sababu ya hali yangu pia ilininyima kufanya hiyo biashara. Lakini kwa sasa naamini kwamba Mungu alinipatia tu pesa kidogo, nitakuwa natembea katika masoko nikifanya biashara niendelesha watoto wangu. Watu wengi wanaficha siri. Na kuficha siri hivyo ndio kuumia. Mimi nilificha kwa muda mrefu sana nikijua kwamba labda nikasaidika peke yangu. Mbona wakati nilijaribu kudisclose kwa mtu fulani, mbona niliweza kupata kusaidika. So naambia mwanamke mwenzangu ambaye ako na shida kama yangu, labda ya kupita choo, labda mkojo, kuna kampuni ya Amref inasaidia sana. Madaktari ni wazuri, wanasikiza wagonjwa wao.
The project has 4 thematic areas. Number 1 is capacity development of healthcare workers, both at the facility level and community level, on maternal, neonatal and child health indicators, basically to improve the reproductive health indicators within this county. Number 2 is to equip these health workers who already have the skills with the equipment. We purchase equipment and donate to the needy health facilities so that they can have an ease in service delivery. Number 3 now is to do medical camps. The broader objective, as I've already said, is to ameliorate maternal mortality, morbidity and disability. So during the medical fistula repair camp, is where we do not only the fistula specific, but a mother with any other gynecological problem. So that is the 4th thematic area. The final one is to have a center of excellence in each county referral hospitals of these counties.
Due to COVID-related cases, patients have really have that fear of coming to the facility because most of the patients think that COVID cases are found in the hospitals or in the healthcare centers. So you find like when we are going to mobilize for these patients, they entirely refuse and it becomes difficult for us also to bring them on board. They really need the assistance, but there is that fear.
For the past years, since the inception, we've been having a smooth implementation phase of this project. Unfortunately, in 2020, we had a hitch. The COVID pandemic came into our midst, and it kind of disrupted the mode of activity implementation. And we started now working within the framework of containing this pandemic. And actually that's why we didn't manage to do any camp the entire 2020. And because previously from 2017, 2018, 2018 specifically 2019, we've been having these camps quarterly or biannually within the counties that we serve. And we managed to do around 417 repairs of both fistula and other gynecological conditions.
Before COVID-19, we used to have a regular fistula surgery camps where most of these ladies were helped during the fistula camps. But since COVID started, literally all the activities regarding fistula treatment has been on hold. So no more fistula surgeries are going on unless in centers where the fistula surgeries have been integrated into the general health provision in the facility. Other thing now with the flare of COVID and the lockdowns, now the number of deliveries also increased, especially home deliveries, home-based deliveries. The lockdowns, people are afraid to move at night. So we realized that complications, deliveries increase with complications. Some of these complications are fistulas also. So the first half of 2021 and the last half of 2020, realized there was an increase in the trends of fistula. Fistula is curable, it is treatable. It is not a curse. It is curable, it is treatable. So if my brothers, my sisters, my moms, my dads outside there, they have an idea of anyone who's suffering from fistula, please let them try to help her to reach a health facility where she can be helped. My appeal is for the government and all the partners, the health partners and your partners, is to improve the quality of the maternal services first, just to avoid complications, because rather than treating the fistulas, we can avoid them, we can prevent them. Fistulas are preventable and treatable. So if we improve maternal health services, as we are doing now through the universal health coverage, this will reduce dramatically the numbers of fistula cases. And we appeal to the partners of Ministry of Health to also aid into training more fistula surgeons, because still we are lacking fistula surgeons in the country. The numbers are not that good as for now, so we appeal to the partners also to at least to boost the numbers, so that at least we'll have a plan to end fistula actually by the year 2030.
For Kakuma Mission Hospital as a facility, I would like to appreciate and thank AMREF, because through such a camp, our facility benefits in so many ways. One of the ways the facility benefits is through capacity building. By the coming of these specialists, they also give some education, mentorship, and capacity building to our staff who remain behind and manage these patients.
This project will be coming to an end sometimes December this year, because that's the timeline. And for Turkana County, for example, this is the last camp, as we do the final ones in the other remaining 2 counties. And the need is still there. The numbers are there. These mothers really need these services. And it is my actually passion and appeal to any institutional or individual donor, so that these services can continue. These mothers can continuously get these services. These mothers' dignity can be restored. They can get their womanhood back. They can remain dry, and become economically viable within the society.
Muda mrefu sasa imekuwa rafiki wangu wa karibu, sababu imenikomboa.